Welcome to our Mirror Healthy channel. If you are pregnant or you have planning coming soon, you'll definitely want to watch this video to know and prevent anemia during pregnancy, the most common cause for maternal and fetal complications in pregnancy and after pregnancy. I hope you will find this lesson helpful. Please like and subscribe for more lessons like this one. You are our power. Let's continue. Anemia in pregnancy. Who is at risk? In this video we will see the definition, sign and symptoms, causes, adverse outcomes, diagnosis, prevention and treatment of anemia during pregnancy. Anemia is when you don't have enough red blood cells to carry oxygen throughout your body. When your body doesn't get enough oxygen from your blood, it can't function properly. You may have anemia during pregnancy if a complete blood count, CBC, shows that your red blood cells, which carry oxygen through your body, are low. The red blood cells, RBCs, contain an important protein called hemoglobin. This protein holds oxygen and helps your red blood cells carry oxygen from your lungs to your body. It also helps carry carbon dioxide from your body to your lungs so you can breathe it out. To produce RBCs and hemoglobin, your body needs a consistent supply of iron and vitamins. Without that supply, your body won't produce enough hemoglobin to properly carry oxygen to your organs. It's common for women to become anemic during pregnancy because they don't have enough iron and other vitamins. Pregnant women need almost twice as much iron as women who are not pregnant do. Signs and symptoms include headache, especially with activity, glossitis, cheilitis, unexplained fatigue, unexplained generalized weakness, shortness of breath or chest pain, especially with activity, dizziness or lightheadedness, pale or yellowish skin, craving or chewing ice, pikaphagia. Pica describes craving and chewing substances that have no nutritional value such as ice, clay, soil, or paper. Craving and chewing ice, known as pagophagia, is often associated with iron deficiency, with or without anemia. Severe symptoms include rapid heartbeat, low blood pressure, irregular heartbeat, enlarged heart, congestive heart failure, placenta previa, abruptio placenta, operative delivery. Causes of anemia. Generally, anemia comes from increased destruction of RBC, blood loss, congenital like sickle cell anemia and thalassemia, acquired, example iron deficiency anemia or infection, impaired production of RBC. Pregnant women are at risk of developing anemia during pregnancy, especially if they are pregnant with more than one baby. Vomiting frequently due to morning sickness. Don't consuming enough iron-rich foods. Have a history of anemia before your pregnancy. Having back-to-back pregnancies with minimal time between. Experiencing a heavy menstrual flow before pregnancy. Certain diseases, including sickle cell anemia and thalassemia, ulcers and polyps. This causes of anemia during pregnancy can be subdivided into two main categories, physiologic and non-physiologic causes. Non-physiologic causes. Iron deficiency anemia. Iron deficiency is the most common cause of anemia in the pregnant woman. It can occur from the increased production of red blood cells, which requires a lot of iron, and also from inadequate intake of iron, which increase in pregnancy. Dietary deficiencies, folate deficiency and vitamin B12 deficiency are common causes of anemia in pregnancy. Folate deficiency from a lack of folic acid occurs due to diets low in leafy green vegetables and animal sources of protein. Vitamin B12 deficiency tends to be more common in individuals with Crohn's disease or gastrectomies. Autoimmune causes lead to the hemolysis of red blood cells, example, autoimmune hemolytic anemia. Parasitic infestations, some examples are hookworm or Plasmodium species. Hemoglobinopathies, thalassemia and sickle cell disease. Physiologic causes. Dilutional anemia. Hormonal changes in the pregnant woman result in an increase in circulating blood volume to 100 milliliters per kilogram with a total blood volume of approximately 6,000 to 7,000 milliliters. While red blood cell mass increases by 15 to 20% during pregnancy, plasma volume increases by 40%. This means plasma decrease the overall percentage of red blood cells in circulation. Adverse outcomes. Studies have suggested that severe maternal morbidity is increased approximately twofold in antepartum maternal anemia. Severe iron deficiency anemia during pregnancy or other causes of anemia increases the risk of maternal and fetal adverse outcome. This adverse outcome can be categorized into two: maternal outcomes and fetal outcomes. First, maternal outcomes. Spontaneous abortion, eclampsia, transfusion, hysterectomy, ICU admission, maternal death. Second, fetal outcomes. Intrauterine growth restriction, low birth weight, infection, preterm delivery, neurodevelopmental damage, death in uterine. Untreated anemia can get worse over time. Having too little oxygen in the blood can damage your organs. It also forces the heart to work harder, increasing the risk of arrhythmia or irregular heartbeat, enlarged heart, heart failure. Diagnoses: iron deficiency anemia. Iron deficiency anemia is diagnosed by complete blood count test. Additional tests may be ordered to evaluate the levels of serum ferritin, iron, total iron binding capacity and transferrin. In an individual who is anemic from iron deficiency, these tests usually show the following results: low hemoglobin and hematocrit, low mean cellular volume, low ferritin, low serum iron, high transferrin or total iron binding capacity, low iron saturation. The listed below are normal ranges of hematocrit and hemoglobin for men and women. Hemoglobin, for men, 13.6 to 16.9 gram per deciliter, and for women, 11.9 to 14.8 gram per deciliter. Hematocrit, for men, 40 to 50%, and for women, 35 to 43%. Laboratory values for pregnancy often change throughout the duration of a woman's gestation. Hemoglobin levels less than 11 gram per deciliter during the first trimester, less than 10.5 gram per deciliter during the second trimester, less than 11 gram per deciliter during third trimesters, and less than 10 gram per deciliter in the postpartum period are considered as anemic. Severe anemia is when results of the CBC show hemoglobin that's 6.5 to 7.9 grams per deciliter. Prevention. In short, strategies to prevent anemia during pregnancy are: food fortification, dietary diversification, take prenatal vitamin and iron supplements or separately, pregnancy follow-up or good health facility. In addition, the best way to prevent iron deficiency anemia is try to get plenty of rest and drink lots of fluids. Eat healthy iron and vitamin-rich diets. The iron from animal products, such as meat, is most easily absorbed. Meat, beef or lamb, especially organ meats such as liver. Poultry, chicken, turkey, and duck, especially liver and dark meat. Fish, especially shellfish, sardines, and anchovies. Iron-enriched pastas, grains, rice, and cereals. Iron-fortified breakfast cereals, dark green leafy vegetables such as broccoli, kale, turnip greens, and collard greens, dried beans and peas. To enhance the absorption of iron from plant sources and supplements, pair them with a food or drink high in vitamin C such as orange juice, tomato juice, or strawberries. Treatment. Treatment for anemia during pregnancy depends on the severity. Mild to moderate anemia can be treated with a daily prenatal vitamin or iron supplement. This gives body to get healthy amounts of iron, vitamin B12 and folic acid. Eating more foods that are high in iron like spinach, lean beef, and turkey. Foods that are high in vitamins that help your body absorb iron, like vitamin C, are important as well, including citrus fruits, tomatoes, and peppers. Severe anemia can be treated by intravenous iron or red blood cell transfusion. Intravenous iron. In some cases, intravenous iron is recommended. Intravenous iron may be necessary to treat iron deficiency in patients cannot absorb iron well in the gastrointestinal tract. Patients with severe iron deficiency or chronic blood loss. Patients who are receiving supplemental erythropoietin, a hormone that stimulates blood production. Intravenous iron comes in different preparations. Iron dextrin, iron sucrose, ferric gluconate. Blood transfusions. Red blood cell transfusions may be given to patients with severe iron deficiency anemia who are actively bleeding or have significant symptoms such as chest pain, shortness of breath, weakness, or other severe symptoms. Transfusions are given to replace deficient red blood cells and will not completely correct the iron deficiency. Red blood cell transfusions will only provide temporary improvement. It is important to find out the reason of anemia and treat the cause as well as the symptoms. I hope you find this lesson helpful. If you do, please like and subscribe for more lessons like this one. You are our power.